and welcome to Health Live at Seniors Today. We wish you a very happy Eid and Akshay Tritiya and all the festivals that you observe on this day. We are delighted to have here with us Dr. Sheetal Goyal, a senior neurologist who is based in the Wokhart hospitals of Mumbai. I'll introduce Dr. Goyal first. Dr. Goyal is as I mentioned, a well-known senior consultant neurologist in Mumbai. She has done her MBBS and MD in internal medicine from the Guwahati Medical College and a DM in neurology and PDF in cognitive neurosciences from the NIMHANS in Bengaluru. She has to her credit both national and international publications. She has also obtained separate training in the treatment of various memory and movement disorders, skills of a variety of toxins and deep brain simulation. In fact, as I was speaking to her before this session, I figured that she's one of the only three doctors in this country who are in the field of movement disorders. She has done many certification courses, of which the prestigious ones are the VEG certification by the Indian Epilepsy Society and a one-year learning course by the World Headache Society. She's also trained in Botox injection given for writer cramps, cervical dystonia, blepharospasm. She's a former consultant neurologist in the Nimcare Specialty Hospital in Guwahati and Apollo Clinic in Guwahati again. She is currently, as I mentioned, working at the Wokhart hospitals in Mumbai. Welcome to Health Live at Seniors Today.
Hello, thank you so much for calling me. Namaste, sabko mera namaste.
Would you like to say namaste in Assamese?
Namaskar.
Namaskar.
Yeah,
and,
namaskar.
It's a pleasure to have you here. And we've had neurologists in the past, but we've not discussed this very important issue of movement disorders, right? And the whole issue about that we are discussing today about memory, movement, and cognitive disorders in seniors. And these are very important issues, and I thought it would be of interest when we were speaking to people at Wokhart hospitals, and we figured that this is a very important issue concerning seniors. We thought of inviting you. But first off, what's the since you are in Wokhart, what is the COVID scene now? Is it under control, or is it it is going up as one keeps seeing newspaper reports?
See, if you ask me frankly, the public has demolished COVID. Because now छोटे मोटे सर्दी में कभी COVID नहीं किया जा रहा है, and mortality definitely is no more seen in COVID. So we have hardly seen any positive case in the last 4 to 5 months. So it has really drastically come down.
That's a very healthy sign. Though one keeps hearing about, I was hearing today that the 5 Supreme Court judges have got COVID, and so clearly the numbers are rising. But you are saying that one, the mortality rate is not very much. Second thing is, it's not as much a worry. But tell me something, and genuinely, is it, is the fear of being isolated, ostracized, your domestic help not coming home, is that causing people not to get out, not to reveal that they have COVID?
See, Frank, the first thing is they will not realize they have COVID. As I told you, initially COVID was very severe in nature. Now just running nose, they consider it a seasonal disease. घर पे भी अगर किसी को हुआ तो माँ बोलेगी अरे ये तो seasonal है, it will come down. And as COVID also comes down, so it comes down and it goes off and they don't even realize they had COVID. So I'm not saying that public is trying to hide it. It is so mild in nature now that people are just not doing it, not thinking it as a COVID.
That's good to know. That's good to know, Dr. Goyal. So before we move, the subject that we have requested doctor to speak on is memory, movement, and cognitive disorders in seniors. Those of you who have specific questions on these issues, please put them in the Q&A tab. As always, mention your age and your gender so that Dr. Goyal could give a more considered reply. And she will make a presentation for around 20 minutes. And then in the meantime, you can send us questions the way you put across in the Q&A tab, and we will address them to Dr. Goyal. Over to you, Doctor, for your presentation.
Thank you. Thank you. I think all are okay with both Hindi and English, right?
Uh, English is the preferred thing because
Got
we have
it.
a lot of people from South
Okay.
India as well. But you can prefer it a bit with Hindi as well. No problem.
Okay. No issues. So, as my audience today, see, 3 days back, I came to know that I am being invited to give this talk, and I felt honored about it. So I thought that I'll keep my content very limited and very simple. So because I'm going to speak on memory issues and movement disorder issues, so my first content will be what are the memory issues and how to prevent it. And second will be what are the memory movement disorders that we see in elderly aged group and how to prevent it, as simple. So what are the symptoms that we see commonly when someone says I have memory disturbance? You will find that the family members is telling that he cannot recollect the recent conversation, cannot recall the name of the family member, keep misplacing his spectacles, etc., here and there, and not able to find it, cannot recollect the items he had in breakfast. So all these comes under memory disturbance. I won't go into technical and scientific things, but today I will tell you about all the mantras that every general public can do to prevent memory disturbance in late age. So the first important thing is the physical activity. Now, I am not the one to say. I think you must be hearing it from your grandfather, grandmother time that you need to do exercise, you need to do aerobic exercise, cycling, and I too say the same. Second, there are certain yogas that are known to prevent memory disturbance. So let us come across what are those yoga. So number one is Padmasana yoga pose that you can check in. If you can see my slide, you can see what is the Padmasana pose. This is a
We
very
can't
famous.
see the slides. We can't. Your screen is not being shared.
Oh, so sorry. 1 second. I think it got. Can you see now?
Well, it's just starting. Yes. So we have a screen of Padmasan. There.
Okay. So this is, so I didn't say much till now. I'm saying I'm going to tell you all the mantras that I give to my patient to prevent memory disturbance in future. So one is the physical activity, another is the yoga pose. Then in yoga pose we have got Padmasana, which you can see in every people who are trying to meditate, who do meditation, who start with their yoga. They start usually with Padmasana pose. It has got certain scientific relevance. It is found that if patient sits with Padmasana pose, it also somehow enhances the cognitive ability of an individual. Then we have got Paschimottanasana pose. It might be tough for people who have never done yoga in the past, but if someone do it, it will really help them in their cognition because it helps in the increases the circulation of blood in the brain and enhances the memory. Then we have got Halasana pose. I tell you, those who are not doing it will find it very difficult, but these are scientifically proven poses which helps in preventing memory disturbance. Another we have got Sirsana. So why all these poses yoga are important? Because it is found that whenever you do yoga or whenever you do physical activity like cycling, aerobic exercise, etc., it somehow causes cardiovascular exercise to that person and it improves the memory and the learning capacity of that patient. Apart from that, it has been seen that if anyone practice this yoga pose or such kind of physical activity, it boosts certain chemicals in the brain which are known as positive chemicals, which enhances memory to a large extent. So some of them are dopamine, norepinephrine, serotonin, which I have mentioned in bold. So endorphin is also increased. You know, endorphin is certain love hormone. So whenever endorphin is increased, it always gives a positive emotion in one's brain. So that's why physical activity like yoga or poses or physical activity helps a person from preventing memory disturbance. So what I want to say is that many a time, because I'm a doctor and I see all kind of patients. So when they smoke, they are tell me that, madam, I smoke because I'm too much stressed. But I tell you, it has been found scientifically that if you run, it also decreases the stress. So I would like to advise you all, if you all are in the habit of smoking during stress, stop smoking and start running whenever you feel stress. Then we have got mental activity. Now you will say, madam, I always drive the car to my office. I always do the things, I always cook the same food. Morning breakfast is cooked by me. So I'm being mentally active. But no, that's not wrong. That's not correct. So according to neurologist, according to us, according to cognitive expert, we don't consider those as a mental active game because those are certain things that you're doing every day. So that has become very automatic in your life. So that won't be considered as a mental active. So what you can do in home, you can play with your grandchildren, different kind of puzzle game. You can play with them all kind of memory card game, crossword puzzles, sukodo, jigsaw puzzle. So these all can help you keep yourself mentally active. Then mindful walking, I won't go in detail, but I'll just tell you the brief of all the things that you can do to keep yourself mentally active. Then suppose in your life, because being a head of the family or being the only person who is earning for the family, you must have got certain desire to learn certain music instrument or learn certain foreign language, which you could not be done in your life. I request you all, come up with your all the hobbies now, because you must be retired. Many of you must have been retired. You must be free now. So enjoy doing all that you wanted to do in your young age. This will help a lot to keep yourself mentally active. You can learn new sports, do hand-eye coordination along with your grandchildren. And ultimately, many of my patients tells, no, ma'am, I don't want to do anything. So I always request them, put a song which you love the most. Chalo 18th century ka gana laga do and just dance whatever way you want. So this also keeps you somehow physically as well as mentally active. Then comes social life. So when I say social life, I don't mean that you will sit with your friend and gossip. So when you say social life, no, for me as a cognitive expert, I describe it as a life where you're contributing something to the social society. So you will say how giving help to someone make me cognitively healthy. What happens is that it has been found in the research that if you socially help someone or take active participation in society, there are many things happen. Number one, you become socially active, you know how to interact, you learn new skills, and the most important is when you help someone, there are certain positive hormones that develops in your brain, and that keeps you preventing from memory disturbance. The another mantra is stay organized. When you stay organized, you don't lose time finding out the things which you are misplacing regularly. And this helps you being confident with yourself. Therefore, stay organized. Then what are the benefits? I have told you already. So sleep well is very important, because if you don't sleep well in young age, if you don't sleep well, even then next day you can work. But as we grow old, no, the sleep requirement becomes very important, because if we don't sleep well, if in later age we find that the cognitive capacity comes down to a large extent. So being in 50s or 60s or above that, I request that sleeping, though looks key, it is a very simple thing. How will it help in cognition? But there are many research paper which has spoke highly about sleep. So please sleep well. Try to sleep well. So benefits, how it benefits, it reduces stress, reduces inflammation, boost your energy, keep you alert during day, maintain a health, and all these psychiatry issues like depressions you are prevented. So what are the foods? So this is the common question that is been asked to me in OPD. Ma'am, what are the foods that we can take which can enhance the memory? So these are certain piled up. I have piled up certain foods which has been research proven that they can improve the memory. So you can go for avocado, you can go for beetroot, you can go for turmeric, raw turmeric, then almond, which you say mamra ka badam, you must have heard from your grandparents, then akhrot, green leafy vegetables, and many more. So these all are the important benefit. Even drinking coffee to certain amount can boost your serotonin and uplift you and prevent the cognitive disorder. So rosemary, walnut, mamra badam, I've already spoken about. And the most important of all, see, these are all preventive. Now, many patients, as the age comes, they start suffering from hypertension, diabetes, thyroid, and many times I have seen that I don't know why, but they just neglect taking medicines. So I just want to show you one MRI difference. You can see in the right of me here, You see these all white patches are on those patients which have got uncontrolled hypertension and diabetes, and they are very strong, very notorious factor that can decrease your memory. But if you can control your hypertension, BP, your brain will always stay healthy even if you are at age of 80s. Therefore, I request you that if you have hypertension, diabetes, thyroid, don't neglect it, and please go to your nearby doctor and prevent it from being uncontrolled. This is certain thing that I have done research on. So this is raga therapy. See, being from India and born and brought up in Indian culture, so I have done lots of research on raga therapy and found that raga therapy has helped my patient a lot in cognitive diseases. So raga therapy is also. So what should be your daily routine? Now you will say, madam, okay, these are the these are small tips you gave, but what should be my daily routine? So your daily routine should can help. So there should be always a routine. Even if you are retired, your children are taking care of the family, your grandchildren goes to school, you have all the excuses to give me, but I tell you, I'm not going to take any of the excuse. Those who are retired, I request them, take a copy pen, make a daily routine. Every day when you get up, before getting out of the bed, you have to make a routine that what you are supposed to do today, what is the new thing you're going to do today, and in what time you will complete all your activities. This will help you keep yourself cognitively active at your best. So lastly, I want to I want to tell you all a very important issue which every doctors also are seen to be neglecting, which is in a very common practice. There are many drugs which can cause memory issues. Why I tell my patients whenever they have any memory issues that please come to me is this is also one of the important reason. Many times memory issues is just considered as age related. It must be my grandpa is 60s or my grandma is on 70s, therefore she is losing memory is not at all a correct statement now. Many of the drugs that patient takes can cause memory issues. So what I do is that if such patient comes to me, I always check their medicines, and if possible, I alternate the medicine. If I know that this medicine which the patient is taking can cause the memory issues, I just change it to the medicine which cannot lead to this kind of memory issues. So this way also we can help our patient a lot. So this is all about memory. Then now coming to movement disorder. As I have got two topics to speak today. So what are the movement disorder commonly seen in elderly? I was just thinking and speculating what should I say. Then the most common that I encountered in my life is fall. Many of my patient comes with fall. Or sometimes they say that I have abnormal sensation in my leg which prevent me from sleep. The third most common is the tremor. The patient says that my hand keeps shaking, ma'am. I'm not able to catch hold of cup, pencil, etc. Or osteoarthritis. So let me speak one by one in short about all of them. So why do fall occur? So fall occur, do you think fall occur due to one reason? No. So fall can occur due to many reasons, like agar aapke joint, if you are suffering from osteoarthritis or any kind of reactive arthritis, if your BP is falling a lot, so immediately when you get up, you will feel giddy. This is the again very common complaint that I come across. Patient cannot see from their eyes properly and they bump over the object in front of them because of the tremor in the leg keeps shaking and they cannot keep hold of them while they're standing. Equilibrium problem, foot problem, they're diabetic. They're unable, they develop sensory neuropathy. They cannot sense the leg, sensation in the leg. And therefore, when they keep their leg in the floor, they cannot feel it. And this leads them to fall. Then illness, if no proper nutrition, you're not taking care of your nutrition. See, you have to understand when you were a kid, if you don't eat whole day, you just drink water also, you will survive. But when when anyone, even me, if we reach by the age of 40s, 50s, we have to be extra careful about our nutrition. So these are very common causes of fall. It is not a small, like it is not an uncommon thing that I'm speaking about. If you see 1 out of 4 people of age at least 50 of at least 55 65 falls every year. And why I'm speaking so much about fall is that because I have seen my patient after falling has developed a big head injury, bleeding under the head, fracture in the femur, and ultimately they have to get admitted for 15 to 20 days. Lots of money goes. They feel so useless. They feel that I am completely dependent on my family. So, and they start developing depression. So it is a vicious cycle. So I always want all of you to understand that fall is a very important thing that need to be brought down in one's life. So again, I say there are many medications, just like those medicines which can cause memory disturbance. There are a list of medicines that can cause fall. So how to prevent fall? These all the why fall should be prevented, but how to prevent it? See, you have to maintain your joint health. If some doctor in your early disease has told you that please go for physiotherapy, I am telling you, please don't neglect and hear that doctor properly. Physiotherapy really helps in preventing joint problem to go to its severe form. Then vascular risk factor like diabetes and hypertension need to be managed, because diabetes can cause neuropathy, hypertension can cause multiple stroke, and patient develops fall. Avoid tobacco and alcohol. See, when you were young, you enjoyed with your colleagues, you drank alcohol, no issues. But you have to understand, if you are at the age of 60s and 70s, you need extra care for yourself. So if possible, please avoid tobacco, alcohol, sleep well, avoid dwell tasking. Now, because we are very busy now, whenever we walk, we keep a mobile in our hand and we keep typing. See, young, okay. But if we are growing old, dwell tasking is not very fluent in our brain. So whenever we plan for dwell tasking, we have a tendency to fall. So prevent doing dwell tasking whenever we are walking, and never get up from lying down position immediately. Other tips are these all that continuous. So whenever you are feeling like you are getting a tendency to fall, please go to a neurologist like me, show them all the medicines, ask them if any medicine is causing increase in their risk of fall. Then the second most common is tremor. So shakiness. See, shakiness is not bad, but when the shakiness becomes so bad that you're not able to hold a glass of water, or if you have been given a tea, the tea spilling and burning your hand is not acceptable. So whenever you get shakiness, it can be drug induced. It can be associated with other disease. So again, I'm saying don't consider it as just age problem. Please visit us. If I can help you out, or any of like me, neurologist can help you out, or certain maneuvers which we can teach you, simple medicines we can give you, which can really help you with those tremor conditions. Restless leg syndrome is thing which is not known by many common public, but very commonly seen. What happens, many of my patients will say that I am not able to sleep. This will be their first term. But when I go in detail, they tell me that, madam, when I'm going to sleep, I feel some tingling sensation. I feel some ants are crawling in my leg. I feel very restless. I keep moving my leg whole night and I cannot sleep. So this is a very classical condition of restless leg syndrome, which is very easily treatable by just 1 or 2 medications. So please don't neglect this kind of symptoms where you will have some movement disorder, some abnormal paresthesia, and there are many other movement disorder which causes your decreased sleep. So just don't say it's a sleep disorder. Come to a neurologist, work it out, and then I think your sleep disorder will immediately get vanished. Then Parkinson disease, as we were discussing before the start of this. See, many times tremor means it is just a tremor. No. So if the patient, when we'll say a patient has Parkinson, when you will realize that your grandpa or grandma or you yourself is starting to lost the weight, or your friend started telling you, hey, like Arvind, your face was so expressive earlier, but now you look so dull. Are you depressed? Is there everything all right in your home? But you are in reality not depressed. This is also a very common symptom that is seen in Parkinson. So if anyone is complaining and looking at you and telling all these things, you have become very slow in walking, very slow in getting up, these all are symptoms of Parkinson. Please visit a neurologist. Again, I tell you, simple medicines can make your life very easy here. So there are various drugs. As I'm continuously telling you, there are certain drugs that can cause movement disorder, memory disorder. Everything cannot be disease. It can be just drug induced. If you change the drug, your life is easy. So you can always consult a neurologist whenever you're developing new symptoms, and just tell them about the entire medication list, and if we can change and prevent you from further worsening with those tablets. So in miscellaneous, see, movement disorder I told separately, memory disorder I told separately, but what are the conditions where both memory disorder and movement disorder can be helped? Number one is your family support. See, your family is your backbone. Always be with your family, always keep cheering. It will increase your emotional hormones. If you have a grandchildren, you will have some goal to achieve, that today I'm supposed to teach my grandchildren a badminton. Tomorrow I'm supposed to teach my grandchildren bicycle. So it will always keep you motivated and always keep you going, and you will feel healthy. You will feel very young even at the age of 60 and 70. This I can tell from my grandparents' experience. Osteoarthritis is something which is neglected many times. If the orthopedics tells someone that you need knee replacement, people hesitate a lot, and I have seen 2-3 years pass by, they don't do knee replacement. See, if someone has osteoarthritis and to a extent they cannot do, even if the patient has Parkinson, I will not be able to help. So if someone has advised, because if you have osteoarthritis, you will not be able to work easily. So you will always feel a burden inside you. Going from your room to toilet will be a very difficult task for you. So whenever needed, please go for anything that medically we are there to help you out with. How hearing difficulty? This is another difficulty. People are not able to hear. They think that it's okay. थोड़ा थोड़ा तो सुनाई देता है. It's okay, I can make out. But I'm telling you, it has been research proven that if you have hearing difficulty, somewhere it decreases your memory because you're not able to express yourself. You feel socially isolated. Your friend is telling you 3-4 times, you're not able to understand what your friend is telling. Your friend will laugh at you, or either they will stop talking to you. They will feel you're arrogant, but the reality is you're not able to hear. So if you have any difficulty in hearing, go to your nearby ENT doctor, take the hearing aid and make your life easy. How yoga can help? Why I have spoken, why I'm going to speak about this, I'll just take 5 more minutes, because I am a certified Raj Yoga trainer from Heartfulness. I am meditating from last 20 years, and from last 7 years, I'm teaching people meditation. Though I'm a neurologist, but I speak very fondly about meditation because I myself have been doing it and I know how beneficial it has been in my life. So in short, I will tell you, yoga are many. So Maharishi Patanjali has found out our yoga, where we have read about his books. So I'll not go in detail. There are Ashtang Yoga. This is Hatha Yoga. You must have known about Sri Ramdev Babaji. So he teaches us Hatha Yoga. There is Bhakti Yoga, who is the example is our Mirabai. Then Karma Yoga, which we all are doing. I am doing right now. You all are hearing. So you're doing the karma of hearing. I am doing the karma of speaking. Janana Yoga, where you read with Vedas, Bible, Quran, Bhagavad Gita, and you learn about the eternal knowledge. Then we have got Laya Yoga, Muladhar Chakra. People want to enlighten it. There are many sanstha's who are doing. And then ultimately the most superior of all is the Raj Yoga, where we completely practice the meditation. So let us speak about meditation, how it helps in movement disorder and memory disorder. So basically, when a person meditates, they start living in present. So this prevents them from past life stress and from future stress as well. So they become very free-minded. When you will speak to a person who do regular meditation, you will find they're very lively. They're living at the present. So meditation teaches them to live in the present. There are many other benefits which just my 1 hour slide also cannot cover. But still, it helps in decreasing the stress. And it also decreases your breathing rate. It slows down your heart rate. It makes your heart functioning well, and many other things. So there are many more. It helps you become your best friend, is something which I have highlighted in red because this is the truth. Meditation makes you feel very comfortable in yourself. So meditation, like you see what stress you have. You need to buy a house, or you need to get your grandchildren married, or you need a home loan, or you need to take care of your children, or your children is not hearing you. There's so many things which I cannot even describe. It's all individual stress. So how stress then ultimately manifests in irritability. They'll say, I don't want to talk to my grandfather because he's becoming very irritable. But they don't understand the stress that you have. But why they need to understand? If you meditate, your stress will come down and you will no more be irritable. So basically, if scientifically speaking, being a neurologist, it basically regulates the amygdala, which is responsible for all your fearfulness, or your anxiety, or your depression. So in short, meditation takes care of your prevents you from depression, anxiety, anger, irritability, and whatnot. So meditation helps you lead a healthy life, successful family, career, etc. I won't go. So this is in short about meditation. So please come to Vokart. If you have any doubt, I'll be more than happy to discuss more and more about all these topics. Thank you so much.
Thank you very much. Thank you very much for a very detailed presentation. I think you touched upon many issues, and it also is good to hear that, you know, a medical, an allopathic doctor like yourself has been such a strong votary of yoga, and that's a good thing to know. I'm just going to put your presentation off.
Yeah, please.
So it was very good to see your presentation. I'm going to before we continue, before we ask all the questions, as always, to all of you here, the edited video will be up on the Seniors Today website along with the takeaways. And the takeaways, as you know, are written by a medical practitioner, a doctor, and so they will be up on the website on Monday evening, and you can have a look at that. The video, of course, will be there on the website on YouTube, but I would always recommend that you look at the takeaways as well, because that kind of compresses everything that the doctor has said, and they'll be there here. So those of you who have found the slides moving too fast, or who do not remember what they were, please do not worry. They will be there on the website very soon, and you can have a look at everything all over again over there. You can pause, you can take screenshots and everything. So Doctor, there's an anonymous attendee who asked, do antidepressant medicines cause memory loss?
Yes, they do. See, antidepressant medicine, if memory issues can be due to multiple factors. If a person is suffering from depression, you will see that they also have memory lapse. So in those conditions only, if you give antidepressant, they will improve in their memory. But per se, if memory disturbance is a separate entity, then they will worsen more with the antidepressant. You got it, no? If a memory disturbance is secondary to depression, then antidepressant medicines will help. Otherwise, it will worsen.
Tell me, doctor, about memory disorder. Now, for instance, just to give you an example, I may not remember who was the doctor we had invited for last week's health webinar, right?
Okay.
Now, in case I have forgotten, is that something I should be worried about?
No. See, if this is the only incident, then you're not supposed to worry. And one more thing is like, there is a difference between memory and inattention, which people always collide and say it's a memory disturbance. If patient is telling me that, madam, I went to kitchen to bring something, which I am telling you from my patient's history only. They say that, madam, my kitchen gayi, I wanted to bring something. When I went to kitchen, I just forgot why I came here. I again came back to my room and I remembered it. And then I went and I brought it. This is not memory disturbance. This is basically inattention. So in such patients, I always say that when you are doing one work, don't see like dwell tasking. I told you, no, you're walking and doing mobile. Similarly, if you're mentally dwell tasking, even in young age, you will find this problem. So as my guru also teaches, that we should always do one thing at a time. So when you're going to kitchen, you be that you are going to get it. But if you're thinking 1,000 things, multiple applications are open in your brain, no, it will just go off. And that is just inattention. Now, you just have to take care of your multiple thinking. That's all.
Right. To Ms. Madhu and Mr. Ajay Khetarpal, I know the slides may have moved fast for you. Don't worry, as I mentioned, they will be there on YouTube today itself, and they will be there on the Seniors Today website on Monday, and you can have a look at.
See, not my fault, now. I was told that I have to speak within 15-20 minutes. And 3 days back, I was told I can speak to 40, I can speak in 45 minutes. So my slides were according to 45 minutes. I piled up in 20 minutes.
Absolutely, it was my fault.
No.
But yeah, but the thing is that we also wanted to have enough time for questions, and which is why we restrict the
No, I'm
presentation to
just
20,
kidding.
25 minutes, and
So
the entire session should be 40-45 minutes is what we want. Okay, there's a question from Mr. Sudhir Srivastava. He's 64. He says, of the four asanas mentioned, what should be avoided by hypertensive persons?
I think that Halsana and Sirsana should be avoided. I think for hypertensive people, not I think, it is that for hypertensive people, all these dangerous Sirsana should not be practiced. It is always good if they practice that normal cycling, jogging, etc.
Right. This is a question from Mr. Basavraj. He says he's 68. I'm quite healthy.
Okay.
Lately forgetting names of friends, people met, associated with people, etc. Please advise what he should do.
Yes. So you forget the name, but if someone gives you a clue or someone tells you that, hey, you remember my name is this. So do you feel that, oh yeah, I can remember it? If yes, then you are not supposed to worry, because with age, forgetting names is very common, which we don't consider as a very serious issue.
All right. Doctor, this is an anonymous attendee. What causes restless legs in sleep? You mentioned it. And
yes.
What could be done to get a good night's sleep?
Yeah. So, see, restless leg syndrome can be genetic, can be due to iron deficiency, can be due to this one dopamine deficiency, or can be many times we don't know the cause. So restless leg syndrome, here the patient will feel very uneasy, some tingling paresthesia, and they will specifically say that when they start walking, that paresthesia goes off. So this is the nature how the restless leg syndrome presents. So causes are many. So we find out what is the iron profile, whether there is iron deficiency. So we treat in that line plus symptomatically. Regarding your another question that what can I do to get good sleep? So there is a condition which is known as sleep hygiene. See, I cannot tell all the points. It is very much available everywhere in internet. You can go and say, what are the sleep hygiene? Example, I'll tell you, the place where you sleep, don't do any work over there. That particular place should only be for your sleep. You should not keep in bed any books or anything. It should be very clean. It should be spacious. You should have a fixed time to sleep. You should sleep in dim light. You should not use the mobile for at least 2 hours, which is not possible in today's generation. It is not possible. You should not use coffee just in the evening or immediately before sleeping. So these are certain sleep hygienes that we advise for our patients. And the place should be clean.
Right. We have another question from somebody who doesn't want to reveal her or his name. I do CBT for my depression with my psychologist. My question is there something that neurology can add that psychiatrists can't do? I'm a bipolar patient for 38 years. And in mania, I can do the Sudoku in 30 seconds. But the same Sudoku is done in 3 to 4 minutes otherwise. Why? And does running of the vagus nerve calm you down?
See, rubbing of vagus nerve, calming down is nowhere something that we practice or we ask the patient, because vagus nerve is a very tricky nerve. It takes care of your entire functioning of the heart. If you, I'll give you an example. If you, so many of them, they will use the bud to clean their ear. You will see many times the children get fainted because the vagal nerve even runs from there. Sometimes if we rub it too much, the vagal nerve gets stimulated, the heart beating slowly. So we don't ask for any such kind of maneuver. Yeah, many times bipolar syndrome can be associated with many other neurological conditions. So if it is bipolar per se is treated by psychiatrists, but if this associated neurological conditions, obviously it can help. And obviously meditation also helps in bipolar.
That's a very crystal clear and definite answer that you have. So where does the psychiatrist's role end, and when does a neurologist's role come in? You know that. We have a question from Mr. Shrikant Kulkarni, who is 71. He says, I learned that the left hand for activities normally done by the right enables strengthening of the right brain and hence the memory.
Yes.
Do you agree?
Oh, absolutely. There is one condition, there is one, you must be knowing, if you go in internet, search about brighter minds. So here what we are doing is, I am not doing, but I am, because I'm a heartfulness trainer. So I can say it's my ashram doing. So basically what we do is that less than 15-year children, they are given training for 3 to 4 months or something like that, where they are taught how to activate their right brain. And there are certain maneuvers that they do. They will do like that, they will do like that. So there are so many maneuvers. And this way they enhance their right side of the brain, and following which you will see the children becomes very cognitively active, very smart in school. And even they can close their eyes, they can just touch the ball and tell the color of that ball. See, you will feel like, oh, I'm telling about magic. It is not magic. What happens is that we have got circuits in our brain. So basically our eye circuit get connected to the occipital lobe and we can perceive the color. So when you do all this exercise, so right side is also activated, then that connectivity also starts with your touch. Your touch connectivity also goes to the occipital lobe and you can feel the color. So definitely I'm yes for it, and I know it works.
Right. We have a question from Katie Daganji, and I better ask her, otherwise she'll roast me. Her question is, what is the reason for getting occasional cramps in the calf muscle at night? Yes. Any remedy that you can suggest?
There are many causes like vitamin deficiency, decreased activity, varicose veins. Then many a time in like decreased activity, as I told, mainly. So what we do, and dehydration. So we look after what is their past history, and even sometimes neuropathy. So when patient comes to me, I look after all these causes, and whichever cause I find associated with the cramps, I treat that cause.
Right. Doctor, another question from an anonymous attendee who's 74 says, where can one find good cognitive exercises?
Good cognitive
exercises.
So you can come to me.
The answer is very simple, but what if he is not in Mumbai?
Okay. See, cognitive exercises, usually I do cognitive stimulation therapy to all my patients. And as I told you, we cognitive experts are very few in India. So you tell me from where are you? If I can help you out, I'll let you know.
These days, as we've learned at COVID, in the COVID pandemic period, doctors are available over Zoom sessions like these.
Yeah.
And so you can always consult with
Yes.
Dr. Sheetal Goyal at the Wokhart hospitals. She had given her email address at the on her last slide. And when we do when you see the takeaways, and that's the advantage of reading the takeaways, we will have the email address and the contact coordinates of Dr. Goyal in that. There's a question from Mr. Satish Kalia, who is 78 years old. He says he hasn't done any yoga asana so far. He does walking exercise, but I find it hard to do any asana. Should I now start doing asana at this age? He said he is 78.
See, if your joints are permitting you, you ask your joint, knee joint, are you okay with me doing this exercise? Telling you frankly, you're laughing, but I'm telling you, this is actually, you should ask yourself. You are your best friend and you know yourself the best. And one more thing I'll tell you, I had recently, just 3-4 days back, one lady coming to me, very young. She went to gym and she came with severe lower limb pain because she walked in the treadmill for 10 kilometers. See, anything cannot be done on day one. You cannot be a marathon runner in one day. You can do everything if your joint is permitting, your health is permitting, but in a very slow pace. It is not that on day one, you're going to do the biggest asanas like Ramdev, moving all the stomachs. No, no, no. Even I can't do that. So you ask yourself, go slow, steady, if you can do. Better is meditation also.
Absolutely. This is a question from Mr. Ajay Khetarpal, who says, Doctor, if there is stiffness in legs, especially the ankles, toes, and at the night time, especially before bed, is it an orthopedic issue or a neurological issue? And
It's
is it
not.
about issue with nerves in the legs, ankle, and foot?
Yes. See, stiffness per se is not a issue of joint. It is either with the nerve which is over functioning, which we say like corticospinal. So it is not basically a function of joint. It is basically a neurological problem. I think you should go and visit a neurologist nearby. If in Mumbai, you can come to me, because stiffness cannot be caused by joint. But yeah, one more thing I'll tell you, like if you have got severe joint pain, then you will try to restrict the movement of the knee joint. That time you will try to keep your legs straight. If you're meaning that as a stiffness, then it can be, if stiffness is due to severe pain, then it can be due to joint issues.
Right. Thank you. We have a question from Mr. Dinesh Paliwal, who's 71. He says, I had shingles 6 months back, still getting pain. It raises chances of Parkinson's, Alzheimer's, and memory issues. What precautions can he take?
Yeah. Per se, singles cannot cause memory issues, doesn't cause movement disorder, nothing. Singles post-herpetic neuralgia is something what you're talking about. By your history, you're telling me that. So post-herpetic neuralgia, I can understand you must be in a very terrible state. It is very treatable, means it can come down a lot by tablets like gabapentin. So it is treatable. That's a good news for you. So I think you should go and get it treated. Even Botox works on these singles, which I give to my patient. So no, don't be worried about your movement disorder, memories. But one thing I'll tell you, any patient who is having chronic pain syndrome are known to have decreased memory function. Secondary to pain, because in pain they are in distress. Again, I said distress, depression, and their cognition comes down. So it can work secondarily, but not directly. It causes memory disturbance.
Right. Doctor, there is somebody who's 65, and she or he has worked for 35 years, and says, but I don't remember the names of many of my colleagues, whereas my friends remember that. And that worries this person.
See, after certain age, to remember a person whom you have seen once or twice is something you are not to be worried about. If you are very far distant friend, you met after 2-3 years and you're not able to recall the name, is absolutely okay. Don't take stress about it. But if it is a very close person, very close, like your son, your wife, or someone with whom you're meeting daily, and then you're forgetting, then you have to be little worried, and you have to look after we have to check for your cognitive examination, that whether there is other hidden problems which you're not able to take it out.
Right.
What I mean by problem is that there are certain, see, in cognitive testing, when we do know, there are many things that come out which patient is not aware of, that, oh my God, I'm forgetting this also. So I'm saying about cognitive testing.
Right. Doctor, it's already 5:45, but I'll take 5 minutes more. There are quite a few questions that have come in. This is from Gandhi. He says he's in Delhi. He's 62. His question is, do you do online consulting? And also, second question is, does COVID affect neurotransmitters? He says he's had COVID 3 times, and the effect COVID has had on him is he coughs every night only. This is Mr. Ravi Gandhi, who's 62. I think we have lost Doctor. Are you there, Dr. Goyal? We seem to have lost Doctor's connectivity. She is got disconnected, but we should just wait for her to come in. In the meantime, what we'll do is, we will put over here on the chat window, we will put down the link for the entry form for where you can pre-register for the health webinars. And as I try and call Dr. Goyal, I will I'm not able to get across to her. Just our luck, it was the fag end of this session. I'm not able to get across to her, so we will wait for 5 minutes if you don't mind, uh, because sometimes it happens that uh, the network fails. It happens to it happens to all of us. It has happened to me as well. In these last 3 years of the health webinar, I've normally never lost a connection, but as some of you who are regulars would have remember that 4 weeks back, I also lost my connectivity. Hello, Dr. Goyal. Yeah, all right. Okay, okay. Thank you. Yes, so Dr. Goyal is going to be back soon. Uh, so those of you, as we wait for Dr. Goyal to be back, those of you who would like to suggest uh, suggest areas that we would like to, like we should handle, we should be dealing with in the next few months, please let us know. We always take note of that. We may not be able to respond immediately with the calling a specialist, but if you have any thoughts, please let us know, and we will please put them in the chat window, or you can mail it to me directly at editor editor at seniorstoday.in. Yeah, we have Dr. back.
Yeah. Sorry, yeah.
Yeah, no, these things happen. These things happen in cities like Mumbai itself. Also, so I'll come back to the question that we have, and we will,
Yeah.
since this is all being edited, we will edit we will snip out the stuff that was.
Please do. Please do.
Okay,
Yeah.
so we have a question from Mr. Ravi Gandhi, who's in Delhi,
Yes.
and he's 62. He asks, "Do you do online consulting?" That's his first question. The second is, does COVID affect neurotransmitters? He's had COVID 3 times, and the effect that COVID has had on him is he coughs every night only.
He cuff, you
Coughs,
say?
yeah.
Okay. See, firstly, I have written a article in one of the newspaper where I spoke extensively about the memory disturbance that my patient has faced after COVID. So obviously, it affects the memory due to through various modalities. Some patient develops autoimmune pathology. Some due to direct viral infection, they affect the memory cells of the brain. So yes, that's a truth, and that's a bad part that COVID has affected the memory. Regarding your coughing at night, may not be related. So whenever my patient, because I'm also an MD medicine, so I used to get such kind of patients. So whenever these patients complain me that when they lie down, they have cough, or when they sleep, they do cough. Many times it is found that this happens because of gastritis. What happens is that whenever there is acidity or something, in simple language I'm using that acidity or something. So what happens is that the acidity, they percolate through the breathing space, and because to expel it out, patient starts coughing. Number one. So you have to look strongly into that part. You can take some like PPI, pantoprazole or something, and check out if it goes off. Or if you are staying in AC and sleeping in air condition, I think you should increase the temperature.
Right. Thank you, Doctor. This is Mr. Sushil Kumar who asked, Doctor, does taking 1 teaspoon of cold pressed coconut oil daily help in memory loss cure?
It is good for health. So if your health is overall good, nothing, I have not found anything related directly to memory.
Right. This is an anonymous attendee who's aged 84. He says he does not have any problem such as high BP, sugar, but his or her difficulty is that they're not able to sleep well, and would like some suggestions.
Yeah. So what happens? No, after retirement, people have pura 12 hours free. They many time they will just sit idle, do nothing. So no, I'm not saying about the person who's asking me question. I'm saying you as a whole. I'm saying in a broad way. So the first thing is, when you want to sleep well, you have to work hard during day, either mentally or physically, to make you sleep well. मेहनत करने के बाद का जो नींद आता है, you cannot compare it with any other thing. Number one. Number two, when you are retired, you feel that the whole day is free. तो दिन में भी 2 घंटा सो लेते हैं, 3 घंटा सो लेते हैं. So how you will get sleep at night? So such patient I always tell, please, if you're sleeping during day, stop sleeping during day. Tell that I'll sleep only night. Third thing, many times as the age goes by, the requirement of sleep comes down. Like to a child, you see, they will sleep 12 hours, 14 hours. As we become very active, energetic, we sleep 8 hours, like that. So when, as the age goes by, the sleep comes down. So usually only 3-4 hours or 5-6 hours. You have to ask yourself, if I slept only 4 hours, whether this 4 hours was healthy for me, whether I'm feeling sleepy during day. If the answer to any of this is no, 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 then it's okay. Don't worry too much about it.
Right. Thank you. Thank you very much, Doctor. We have a few questions which have come in from Mr. Sri Krishna Agarwal and Ms. Shada Malviya, which we are not going to take now because they're very...
No problem.
specific.
One thing, I do online consultation. As you have
Right.
asked one answer, I forgot to tell. I
Right.
do online consultation, but I'm always very happy when they come physically, because I ask them 1,000 questions. But online, you have certain limitations. I cannot touch them. Being a neurologist, now our examination is never complete till I touch. So I feel little insecure that, I don't want to miss anything when some patient comes under my name. So I'm always happy to do physical, but yeah, online I do for my old patients from Assam, Bangalore, Kolkata. They all are doing online consultation with me.
Right. Thank you very much, Dr. Goyal, for your time. We've taken almost an hour here, and the few minutes that you joined before that, and you've answered all the questions so well. You have your presentation, not one, but 3 of them were very detailed and explained everything well. And it was good to know that, you are so much into meditation and yoga. So that's something which is will also help all our readers and viewers over here. Thank you very much once again, and thank you to Wokat Hospitals to facilitate this. And we will call on you once again for another session on neurological issues. And until then, thank you very much. And to all of you here, we will be back once again with a session on Health Live at Seniors Today next Saturday at 5 p.m. Thank you very much, Dr. Sheetal Goyal. Thank you very much.